Hello, everyone. This is Savannah Smith, and I'm going to be talking to you about limited access to healthcare resources in rural communities, Chapter 10.2. Limited resources and access to needed healthcare has become a major source of healthcare disparity in rural communities. Rural patients have to contend with limited resources and sometimes inadequate care. Rural healthcare providers can call upon or are called upon to work long hours and are sometimes at the risk of exhaustion and burnout. They are asked to make difficult ethical decisions regarding the allocation of scarce resources to provide services clearly beyond the levels of expertise, which brings forth ethics dilemmas pertaining to competence of care. A system level solution needs to be implemented to resolve these issues. Um, in order to resolve these, funding is very important, and it's really important that we get the community involved in that funding, such as pastors, police officers, different things like that. Um, Stressors is another thing that can occur with rural healthcare providers due to their decreased resources. There is personal and professional isolation, especially in their role as the town's carrier of secrets. Cynicism is associated with exhaustion and burnout. And there's also increased patient risk when rural clinicians are called to work extreme overtime to the point of increased fatigue to make decisions beyond their level of expertise and to cope with limited resources. Um, Physicians are people, and their inherent values, morals, and judgment systems may clash with those of certain patients depending on what problems and diagnosis may be. The clinician's decision making in resolving ethical conflict should be guided by clinician illness factors, um, ethical principles, legal mandates governing the situation, collateral and collaborative information, and consensus to pursue at least the least restrictive or intrusive intervention. And although documentation and thorough documentation of the decision making process, the provider should approach ethics conflict situation on a case by case basis. Um, with the lack of resources provides a need to maintain confidentiality, which includes but is not limited to being mindful of confidentiality importance to patients, discussing with the patient strategies for maintaining confidentiality, um, direct patients to a mail order pharmacy where medications can be obtained, educate colleagues and staff members about confidentiality and effective patient care, making it routine practice with every patient and following up on leaks, and keep records out of public view and or keep sensitive records separate from other healthcare documents. Another discussion was a lot about community education and making sure that community members are educated on confidentiality as well as different illnesses that may be considered um, kind of out of the norm or bad, I guess you could say, by community members. Um, Clinicians should approach each situation on a case by case basis and be aware of patients' feelings, perceptions, and understandings of his own illness as well as community wide myths and beliefs. Rural healthcare practice, despite its limitation, must be guided by ethical principles. Stigma related conditions are essential for rural providers to undergo so as to enhance their ethical principles. Education of general public, thorough community forums, and various stigmatizing illnesses may help to dispel associated myths, and collaborative relationships are important and effective in fostering patient referrals and working with the county, state, and national agencies to advocate for financial resources to enhance rural care delivery systems. Um, in regards to possible case study solutions, Dr. Chen should discuss all possible treatment options for Mr. Baker. Mr. Baker needs to be involved in his own healthcare decisions. He may want to discuss the possibility of talking with a psychiatrist via telephone or with the use of telemedicine. A lot of places now are providing those options. Dr. Chen also needs to reassure Dr. Baker, or Mr. Baker, excuse me, that any information that is shared with him is confidential and that he is there to support him. He should also encourage him to use his wife as a support system, or ask him if there is anybody else who he can confide in as a resource. Dr. Chen should also follow up with Mr. Baker to be sure that he has visited the psychiatrist, and also if he has not, to discuss why, or see if he can try and maybe attack a different plan for him, or make a different plan of care, just if that's something that Mr. Baker isn't ready to do. And then Dr. Chen may also need to collaborate with another healthcare provider in order to determine the best route of treatment or how to handle the situation, especially in an ethically appropriate manner. So that's it. Thanks.